Hello everyone, it is an honor to present my research journey as the AOTF Early Career Research Excellence Awardee. My name is Ickpyo. I'm an assistant professor in the Department of Occupational Therapy at Yonsei University in South Korea. My current research focuses on measurement sciences using item response theory and ROSH analysis, and health services research regarding comparative effectiveness in post-acute care settings, and finally, cross-national health comparisons using national panel survey databases. First, I want to talk about my mentors. I met Dr. Margot Holm during the master's program at the University of Pittsburgh. She was a great mentor because she believed that I would be good at research methodologies. When I told her that I wanted to pursue a PhD, she suggested that I contact Dr. Craig Veloso. He is a measurement expert, and I learned several measurement techniques from him, like item response theory models and ROSH model. Under his mentorship, I was able to publish 6 manuscripts during my doctoral training. At the end of my doctoral training, Dr. Veloso told me that it would be better to work as a postdoctoral fellow and learn other research methodologies. So I worked with Dr. Timothy Reinstetter as a postdoctoral fellow because at that time he had an R1 project and wanted to create rehabilitation research areas using Medicare claims data. Dr. Veloso was right. I learned more research methodologies like data management skill, advanced analytic methods from Dr. Reinstetter. He was a great mentor because he also taught me how to write a manuscript. So during my postdoctoral training, I was able to publish 12 manuscripts. At the end of postdoctoral training, he recommended that I pursue a K-12 scholar position because the position could protect my research time as a junior faculty. So I worked with Dr. Kenneth Barker as a K-12 scholar. Under his mentorship, I learned several big data research methodologies. Dr. Barker was a great mentor because he knew what I needed to become an independent researcher and provided every resources for my research projects. Dr. Reinstetter was right. Spending 70% of my time on research allowed me to be able to publish 22 manuscripts as a K-12 scholar. I couldn't have built my research career with my mentors, and I will always appreciate the academic and personal supports they have given me. I will now talk about my research areas. I learned item response theory approaches from my doctoral training, and I still use this technique for creating instruments and examining the psychometrics of various patient-reported outcome measures. Most of the time, I use the ROSH model. It is a simple probability model that uses the person ability and item difficulty parameter. It is a great measurement model because it can convert an abstract latent trait into a linear interval scale. For example, we can create a fatigue scale and calibrate the item difficulty of daily activities into a linear interval scale. I was able to publish 23 manuscripts using IRT approaches, which account for about 50% of my papers. Specifically, I use IRT models to create a crosswalk between 2 instruments and conduct cross-national health comparisons. In addition, I worked with my colleague to examine the psychometrics of their instruments, like dysphagia, low vision. Because of the useful methodology and collaboration with others, I was able to be productive in a short period of time. The other research area is health service research. When I was a doctoral student, I realized it is difficult to recruit subjects without funding support. So I started using secondary data like national panel survey data, Medicare claims data, and electronic health records. Using these databases, I have published 19 manuscripts so far. I had data management and analytics skills from my postdoctoral training. However, I didn't know specific research questions. So I began meeting with my colleagues who are good in their contents area, like autism, cancer, and physical activities. They gave me research ideas, and I searched for secondary data and conducted data analysis. By working with other researchers, we are able to publish several more manuscripts. Here is an example of health service research. The research team at the University of Texas Medical Branch wanted to compare stroke outcomes between inpatient rehabilitation facilities and skilled nursing facilities. Often, individuals with strokes are discharged to inpatient rehabilitation facilities or skilled nursing facilities, and those two settings provide similar rehabilitation services. However, it was not clear which setting is more effective in terms of stroke outcomes. So we compared physical function between two settings like self-care and mobility scores measured at discharge from each setting. In this study, we merged 4 different Medicare claims data. We included 100% of Medicare beneficiaries with stroke in 2013 and 2014. The study design was a retrospective two-group pre- and post-test design. In this case, the intervention was the rehabilitation services from each setting, and we compared physical function score using 2 ADL instruments. In addition, we control for the baseline physical function scores and demographics for pair comparison. However, the two patient groups had such different demographics, clinical, and facility characteristics. This table presents the descriptive statistics between two settings. As you can see, there are significant differences between two comparison groups. In other words, we couldn't compare stroke outcomes because the two groups are so different each other. So we utilized propensity score matching method to balance the baseline information between the two groups. The best test design was a randomized clinical trial because this design randomly assigned subjects into two groups and balanced all information except for the study intervention. We use a matching method to mimic randomization and balance the baseline information, then compare the effect of the facility type on stroke outcomes. Here is a propensity score model. Basically, we balance the baseline information between comparison groups using a propensity score. In addition, we use multi-level modeling to account for the patient and facility information. Here are the results. Again, before using propensity matching method, the baseline characteristics are so different between two facility settings. However, after using propensity score matching method, most information was balanced. In other words, the comparison groups are so similar except for the rehabilitation services. So we compared stroke outcomes measured at the discharge from each setting. Here are the results. We utilized various statistical models to compare the stroke outcomes between the inpatient rehabilitation facilities and skilled nursing facilities. In these bar graphs, the blue bar presents the function score from IRF, and the orange bar presents function score from SNF. Regardless of statistical models, individual discharge from IRFs had higher function scores like motor and self-care than those from SNFs. Now I want to talk about what I think is important in pursuing a research career. I think research is all about perseverance. For example, my dissertation paper was rejected 6 times over 2 years. Each time I received a rejection notification from a journal, I was very frustrated. However, I didn't give up and eventually published the dissertation paper. Sometimes you might receive insulting comments from reviewers. I want to share some actual comments on my manuscript. Here we go. I don't understand what you're trying to say here. I'm not following the logic of this paragraph. Also, this sentence doesn't really make sense. There is a general carelessness in the use of blah blah blah. Here is the best one. I have no patience with your speculation regarding blah blah blah. Again, these comments hurt me a lot. However, one of my mentors told me it is the nature of publishing, so don't be frustrated, and helped me to address those comments. In addition, this is the most common comment from reviewers. Please have manuscript checked for English grammar and syntax, as they are concerned with sentence structure and meaning throughout the manuscript. And here is my response. We agree with the reviewer's comments. The first author's primary language is not English, so we have now modified the manuscript based on technical consultation from a university writing center. Whenever I submit a manuscript, I visited a university writing center or at least work with my mentors and edit the text line by line. In addition, I apply for a journal reviewer and editorial board member to learn writing skills. I'm still struggling with writing manuscripts. However, I feel comfortable because I know what to do and I know I can get the manuscript published if I don't give up. So I believe a big part of research is about perseverance. Here are my tips for doctoral students and junior researchers. First, try to find good mentors because you need research support to become an independent researcher. Second, don't give up. I still remember a comment from Dr. Holm. She said, no pain, no writing. Finally, respect other researchers and work with them to be productive. Here are my colleagues. Thank you very much. I feel very honored to have been awarded the AOTF Early Career Research Excellence Award and be able to share my work with you today. Thank you.